You think you are paying for surgery. You are actually paying for codes. CPT, ICD, modifiers, RVUs, pre-authorization. I'm Dr. BenMaamer, board certified general and vascular surgeon, and I see what happens when this is ignored. Let's talk about the billing circus behind modern medicine. So let me start telling you what people think. They think doctors bill for procedures. Insurance pays fairly. Complexity equal payment. The price reflects difficulty. I wish that was correct. But let me tell you what actually happens. Healthcare billing runs on two major systems. Current procedural terminology, CPT, International Classifications Diseases, ICD. So the ICD is diagnosis, CPT equal procedure. If the why does not justify the what, payment denied. And here the part most people don't realize. Many reimbursement structure was designed by administrative committees, not practicing surgeons. Payment formula do not always reflect technical complexity, risk level, intraoperative judgment, years of training. They reflect relative value formula. So why this is a circus? The diagnosis shuffle, same patient. Different diagnosis, wording, different payment, language drives reimbursement. The modifier maze, a two-character modifier missing full denial, not clinical failure, formatting failure. Let's talk about the RVU illusion. Physicians are paid based on relative value units, RVU. RVU attempts to quantify time and effort, but they cannot measure decision pressure, unexpected complications, surgical judgment. Two procedures may have similar RVUs, but dramatically different real-world risk. The authorization trap. A medical appropriate procedure may require prior authorization, which means an administrator reviews documentation, often someone who has never performed the procedure. 5. Site of service distortion, same procedure. Hospital, different payment. Outpatient center, different payment. Office, different payment. The anatomy did not change, the building did. So, what are the consequences? Administrative burnout. Doctor spends hours documenting for compliance, not clarity. This is big, the defensive documentation. If it's not documented, it did not happen. Notes become protection tools. Don't forget that. Delayed care. Prior authorizations delay necessary treatment. Disease doesn't pause for paperwork. Higher system costs. The coding staff, compliance teams, audit departments, administrative overhead, all this increases pricing. Misalignment with complexity. Some of the most complex procedures are not proportionally valued. Complex judgment is difficult to code, so it often isn't. What can you do as a patient? Ask if prior authorization is required. Request CPT codes for major procedures. Understand denial does not mean unnecessary. I know some verbiage sounds like Chinese and it's confusing actually on purpose. But if it's so important and we need to talk about it and we make it familiar among us. Yes, and if you believe healthcare in America needs to change, hit follow. We are building momentum one video at a time.